Welcome everyone, Dylan Gemelli here today with a brand new video for you. So today we're going to talk about letrozole. Now just let me remind you, I'm not a doctor. I am not encouraging any sort of use, not telling you to do anything. What you do with this information is for your entertainment, and I can't control anything that you do with it. Just know this, I'm not a doctor. I'm only giving you information that I've learned over time or that I've accumulated, been around, etc. And that is it. So that being said, let's get into this video about Letro. Letro is also known as Femara. So if you see Femara, that is Letro. Just so there's no confusion, because I've had people ask me, what is Femara? Well, it's just Letro. And it is an oral aromatase inhibitor, and it's actually used for the treatment of hormonally responsive breast cancer after surgery. Now, the FDA actually approved its use in postmenopausal women who show hormone receptor positive types of breast cancer. Now, it was banned in India in 2011 because of its potential risk to infants when used in women who are pregnant, but a Canadian study done by the American Society of Reproductive Medicine showed no evidence whatsoever of birth defects at all, and as a result it remains legal in the rest of the world, so only in India. Now, let's talk about some off-label use. Letrozole has many uses, all right? Aside from its female breast cancer use, typical of all aromatase inhibitors, Letro has off-label uses in medicine. Since 2001, the main off-label use has actually been as a fertility drug because of its ability to stimulate the ovaries. Now, another use, because of its strong anti-estrogen properties, is to use in a stack with misoprostol for early pregnancy termination. It's also, has off-label use as a treatment for gynecomastia, which many of you know, and it's used in a stack with growth hormone to actually help adolescent boys grow taller. And it even promotes spermatogenesis in male patients, which boosts their sperm count. It's fairly inexpensive, which makes it a pretty unique and versatile drug. So how exactly does it work? Well, similar to all aromatase inhibitors, letrozole, by binding to the aromatase enzyme, prevents estrogen from being released. It's known as a type 2 aromatase inhibitor. So, it's the most powerful aromatase inhibitor available. I think most people know that, but there's some that may not. Studies have shown it to drop estrogen levels in women by up to 98%. In men, clinical studies have shown a drastic reduction in estrogen levels extremely fast, up to 65%. Now, the main reason may be because it has the ability to actually crush estrogen through, competitive and reversible binding to the hermy of the irrelevant cytochrome P450 unit, which is a protein enzyme. Now let's talk about uses in bodybuilding. Since letrozole is so powerful, it can be a great weapon for emergency situations. That's why I always say letro is a last resort, where estrogen-related sides just get just out of control. Now, when an anabolic steroid user uses compounds like test, D-bol, things that convert to estrogen, trestolone, they will aromatize in the body and they are going to convert to estrogen. And this can resort into multiple estrogenic side effects, things like water retention, which has a domino effect, and it can affect your libido, it can affect your sleep, it can affect your blood pressure, and it can definitely drastically drop your energy. And it can also make you gain unwanted fat. Now, another dangerous side effect and very troublesome is gynecomastia, which, if it's left untreated, it can require some quite expensive and invasive surgery. I know, I've had it. I've done a video talking about that. Now, that was not from the cause of using steroids, but I've still been through the surgery and I've been all through it, so I know firsthand. Now, for this reason, it's crucial to use an aromatase inhibitor if you use aromatizing steroids during your cycle. Now, as I said earlier, letrozole is perhaps the most powerful aromatase inhibitor in the world, as it's been shown in studies to reduce estrogen levels very quickly and very sharply. Now, many users have commented on how effective Letro was to actually just stamp out their gyno while on cycle when other aromatase inhibitors weren't doing it for them. All right. Now, if a user just totally neglects to use an aromatase inhibitor from day one of a cycle and finds themselves in desperate shape, they can turn to Letro as a really quick gynecomastia cure. Now, in a recent study on rodents, letrozole destroyed breast tissue tumors which cause, it kind of gives a glimpse of how effective it can be in treating human gynecomastia. When it comes to treating gyno, there's nothing that's more effective than letrozole. So literally nothing. And that's why Letro is part of pretty much every anti-gyno stack that you're ever going to see out there. It's the only aromatase inhibitor that can possibly save you from surgery. And I always tell people, if you have pre-existing like pubertal gynecomastia, I'm going to give you a 15% chance to actually get rid of it. If that, with, drugs, over-the-counter drugs, etc. Letrozole is the one chance that you've got to actually get rid of it. Now, it's going to take some other things to stack with it, but that's the key component. If you get gyno on cycle and it gets out of control and aromacin's not doing the trick, Letro is your last resort. So keep in mind, you don't want to use it unless you have to, because it's so strong. Now, let's just talk about Letro versus Aromacin Arimidex. Letro is not a suicidal aromatase inhibitor, meaning it will not permanently disable the aromatase enzyme. So it's not the same as Aromacin. The other difference is Letro is far more powerful at crushing estrogen levels than either Aromacin or Arimidex. And I would use it in emergency situations over the others, but I would not ever abuse it. Please don't do that to yourself. There is such a thing as too much in the bodybuilding world, and when it comes to AIs, Letrozole definitely fits that bill and that standard. So, although as males we view estrogen as female hormones, that does not mean that we don't need it in our systems, because we absolutely do. Just like females do need testosterone in their systems, not like we do, obviously, but they need it. Estrogen helps males grow muscles, all right? And a lot of people don't know that, but it does. Low estrogen can cause depression. It can affect your mood. It can hurt your immune system. It can lower your libido. And since Letro is so powerful at dropping estrogen levels, you got to be careful not to abuse it. All right, you should always keep it on hand for emergencies, and always have it on hand before running a cycle. You should just always have some there. You probably won't need it, but you should always have it there for a rainy day. Now, the half-life is approximately 2 to 4 days. Dosages are going to vary, okay? 0.25 milligrams up to 1 milligram every day or every other day is a good starting dose. A lot of times you got to work your way up to that 2.5 level. It's very wise to be as conservative as possible to start with, because if you overdo it, the sides can be harsh, and there is just... I always say this, okay? You can always dose too low and then raise it, but if you start too high, you're already going to have the problems. You know what I mean? So working your way up is one thing that you can deal with it, but you don't want to start it too high. You never want to do that to yourself. So that, my friends, is Letrozole Femara. Just wanted to give you all the information that I possibly could on that. So www.icearms.com/forums. You can also get me on the Evolutionary Forum as well as the Elite Fitness. And Dylan@icearms.com is my email. Now, make sure that you check the descriptions, read all the descriptions, learn about the videos, see my social media links, all my video links, all the information you need to know about me. And make sure to subscribe to the channel. So, that being said, stay tuned for plenty more to come. Dylan Gemelli, signing off.